I'm just introduce myself very shortly. My name is Tehila Refaeli from Ben-Gurion University, for those of you who join us later. In this session, we are going to listen to views from the Global South. We are used to reading and learning primarily from studies originating from Europe and the US, the Global North, but less from other areas of the world. Therefore, we would like to devote the next 45 minutes to learning about care living and care living research from the South and especially from Africa. We will have 3 presentations and then we'll have about 20 minutes for your question and comment. Please write your question in the chat box during the presentation as you did right now. So we are moving to our first speaker. It is a great pleasure for me to introduce Kwabena Frimpong Manso, who will talk about his work in Ghana. Kwabena is a senior lecturer in the Department of Social Work at the University of Ghana. His research interests are in young people living residential care in Ghana and other Global South countries, and is a founding member of ANCARE, Africa Network of Care Living Researchers. So Kwabena?
Hey.
Yeah.
Hi, everyone. Thank you for having me this afternoon. So I'm going to share my lonely journey in Ghana as a care living researcher. I started with my PhD in 2009, and my interest was generated by having spent some time as a social work student in SOS children's villages at the time. And my impression of the children's village was that they had almost everything that I had at home, and I came from a middle-class family. And so going into the residential care facility, I always imagined they would be deplorable and they would be deprived. And so a few years after doing my internship in SOS and having made some friends, some of them started calling me with all sorts of problems. And so when I got the opportunity to do a PhD in Queens, I decided to kind of go and investigate why, after living in a very affluent residential care institution, they were having all sorts of problems. And so much of my research, but when I was going to do a PhD, I wanted to do a comparison between SOS Children's Villages, that is a privately owned international NGO run facility, and then the government run institutions. But at the time, the government wasn't bothered about care living. They didn't see any use in having a research on care living. And there was also some scandal that happened at the time. So I then had to use only SOS Children's Villages, which had a more organized system. So they had started thinking about transitions. They have multiple ways of preparing young people for living care. So since my PhD, much of my research has focused on different aspects of SOS Children's Villages youth. I've looked at aspects of their preparation. I've looked at what support they have, especially when Ghana does not have statutory support for young people who leave care. I've used 2 theories. I've used resilience and social capital to try and understand how these theories help explain the findings that I'm having. Some of my findings have been, some of them have been positive. SOS youth largely would finish senior high school, which is what a majority of young people will finish in Ghana. Some go on to do their bachelor's degree, master's degree, because of the support that they have in SOS. So SOS has money and can provide them support till they do their bachelor's, or even if they can go up to the master's level, they would, which most residential facilities don't have those resources and don't even care to support care livers to that level. My present research has been, we've just finished a 4-country study, which largely came from a grant from my former university, Queen's University Belfast, with Dr. Benny Kelly being the principal investigator. And we tried to look at the suitability of some quantitative and qualitative tools that have been developed in South Africa and used for a longitudinal study with a residential care facility in South Africa, and wanted to see whether it would be applicable in other African countries. So there are 4 countries: Uganda, Zimbabwe, Ghana, and Uganda. And we've just finished writing up the report. The project has ended, and soon we'll share the findings with interested colleagues. I'm also trying to, as I'm part of ANCA, African Network of Care Living Researchers, one of our aims is to develop the next generation researchers interested in care living, since basically I'm the only one interested in care living in Ghana. I think apart from some of my students that I'm coercing to get an interest in care living. Luckily for me, I've had 2 international students who have been able to convince. So there's one who's in Nigeria and who's written a paper or done some studies in Nigeria, though it was a small study with also SOS. We couldn't find any other residential facilities that were interested. And currently I have a student from Liberia, and I've been able to convince her. And one of the interest in Liberia is because it's a post-conflict country, and we want to look at how care livers are surviving in very hard situations in Liberia. So hopefully she's just about to start it, and we hope to get some results from that country as well. Based on the study that we did in the 4 countries, I'm hoping to be able to, and get inspiration from Rowan and Mark, hoping to maybe do a pilot, a longitudinal study in the future. Also, part of my interest now going forward is that Ghana has been, over the last few years, been doing some childcare reforms, and we're trying to move away from residential care to foster care, which has been a struggle. But over the last 2 years, we've been able to get some people to become foster parents. And so maybe to move the care living research to look at if foster care, what are the outcomes for children who go into foster care in Ghana, but also to look at other community-based kind of care practices. So we have some queen mothers who basically are taking care of. Queen mothers are traditional leaders who take care of orphans within their communities till they transition to adulthood, and that's also an interest going forward. I'm also I've been trying to influence policy, which has been very, very difficult. And so I asked Rowan whether she's been successful in Jordan, because I've been very frustrated. Everybody seems concentrated on children whilst they're in care, and nobody seems to bother or care about what happens to them, even though I keep arguing that we call our institutions orphanages, and if it's only orphans who are going into these homes, then basically the parents must carry on their responsibilities till way after 18, which is typical for most young people in Ghana. And part of that, trying to influence policy, is I'm trying to develop a care liver network. I tried doing that with SOS Youth, which is still running, but I want to do a national one. Taking inspiration from the fact that the Kenyans have been able to do a good one. I know India is doing one now. There's one in Zimbabwe. And so that use that care liver association to leverage some form of capital to influence policy. And I'm also quite recently have been involved in trying to get data on care livers. So up to now, there's no system that captures where these care livers go. But UNICEF is developing a program which I'm part of, and initially it was not for care livers, it was just for children in care, just get data on children in care. But I've tried to push them to add a care living component so that we can capture young people who are going out of care. And we have started the first round of collecting that data. So hopefully I would get some small database that I can use maybe hopefully in the future for some quantitative studies, and also be more active in ANCA and see how it can also help develop some up-and-coming care living researchers across the continent. So that's my presentation for today. Thank you very much.
I'm going to move to the question now and start with Kwabena. And Kwabena, actually all of you got very positive responses and and many comments and very praises to your work, but I want to start with a question. So Kwabena, you have a question, what the meaning there is to the network or the international network for your work specifically and for young people in care in Ghana?
Is it the networks in Ghana or the networks in terms of
international?
Okay. Yeah. So, well, I think INTRAC and also possibly INTRAC will give me a wider opportunity to meet other researchers, collaborate, because as Rowan says, it's very lonely if you are the only person doing research in your country. You need other collaborators to share ideas with. Sometimes there's just the energy to go on writing the papers and do what you do. It's sometimes difficult if you are the only person. So these networks help you get new ideas and especially get collaborators and the energy to drive
on. So another question for Kwabena. The question is about the care liver network in Ghana. Do you participate in this? Do you use it in your studies in some way? Okay. And how?
So it came about as I didn't start out to do it. When I was doing my PhD and collecting data, the idea came up together with some of the staff of SOS. So we started it for SOS. But over the years, I've also talked to other care leavers from other residential institutions who, though have a lot of connections with other care leavers from their institutions, don't know other care leavers from other institutions. And I'm trying to bring out this idea that once they have an association, then we have a better way or better platform of advocating for something for care leavers. You know, and I think the Kenyans have been an inspiration and the reason why I'm bent on doing it, because the Kenyans have been able to use that to leverage money to do all sorts of things and have also been able to influence policy in terms of the care reforms that are going on in that country. So now my primary aim is to get a platform that can be used to influence policy, but also maybe it will also give me an opportunity to do research with much more care leavers from various residential care institutions.
Okay, thank you very much. And the last question for you is that you refer to the issue how care leavers forced to be individual in collective context, similar to what Rowan mentioned. And the question is, what did you observe helps them or helps the resilience in these conditions?
Well, I think it's two ways. One is that those who are resilient have that capacity, individual capacity to navigate and draw on resources that are available, but also to use their networks. So though most of them don't have families that they can rely on, either because of poverty or because of the loss of connections whilst they've been in care, they are able to count on themselves, you know, accommodate each other, provide themselves information about jobs, and sometimes also use their agency to draw resources from other people, from volunteers who came into the institutions, from their previous sponsors, and from other community sources. So basically, it's a combination of their individual capacity to know how to identify and utilize resources, but also to be able to draw on support from other networks.
Thank you very much.